Consultations. Consultation is a very important part of dealing with patients, and on a regular basis having an accommodation so that each and every one of the patient actually communicates with the doctor. Often patients are wondering whether or not this is the office that they want to go to. Patients are leery. They're not too sure. Are you the right doctor? Is this office appropriate for their treatment? Remember, there are three major components of a patient's concern. Number one, can you as the doctor help me? That's the very first question they want to know. Can you help me with my condition? I am hurting, I have been ill, I am not well, whatever the case may be, but this has been going on for quite some time and I want to know if you can help me. That's the very first question that they have. The second question is, how long will this process take? Is this going to be something quick? Is this going to be something redundant? Or at any given time, you're going to give me this whole story where I have to be in treatment here for the next several months? Patients are leery about that. Patients are not comfortable to come back to your office over and over and over again for treatment which are not beneficial to them. And the third question that patients have are about financial aspect of the treatment. Can I afford it? How much will this cost me? Does my insurance cover some of it, part of it, none of it? Which is the case? So three main questions. Number one, can you help me? Number two, how long will it take? And number three, if so, how much would it cost? Those three main components are so important that you have to be able to sell to a certain extent to the patient your abilities to treat them. Patients are focused. If you think about it, patients are somewhat egotistical about their own being. And not only that, they're also selfish. After all, I'm the one who's hurting. I'm in pain. I want to know if I come to your office and you can help me and how long will it take and all those questions we discussed, is this a right fit for me? Am I comfortable coming to your office about that? And if so, will I come back and will I also refer some of my friends? Interestingly enough, how would you know whether or not a patient is pleased with your treatment? Other than the fact that they will A, let you know, B, come back for treatment, C, stick with the whole protocol of treatment for a period of time, they will actually refer. That is your number one resource of information to know if patients are happy. For every single patient that's coming to your office, you should have 3 referrals. Every new patient that comes in should on a regular basis refer to you in the next 2 to 3 months at least 3 new patients. If you are at this level, you've indeed attained the best and most ultimate way of practicing. If you're not, something is missing. What do we do to entertain the thought of a patient and how do we accommodate a patient in their treatment? One key component is the consultation. Now you must understand that the consultation is not an examination. It's not a comprehensive exam about orthopedic, neurological development, protocols, documentation, digging into their insurance company's information or finding out all their history, whether social or familial. No. A consultation is a focused, literally short period of time between the doctor and the patient. So what do we do at a consultation and when is a consultation appropriate? Consultations are appropriate with all patients who are either not sure of the treatment or are new into your clinic. How does a consultation run? My best recommendation, number one, is we have it practiced perfectly. Form a letter format, which we would gladly give you, that you would hand out to the patient. The patient knows in advance what the consultation is all about. And the consultation clearly states in there, in the letter, something which we would hand them out and let them read before meeting with the doctor, that the consultation is short, it's certainly not focused on any one diagnosis, it will not include all of the protocols of documentation, and by no means does it obligate the patient or the doctor to a treatment plan. It strictly focuses on the opportunity to give the doctor and the patient to acquaint each other, to become not only accustomed to one another, but to find out whether or not it's a match. A consultation is important because you quickly can go through the systems, a review of systems from a physiological and obviously biomechanical standpoint and find out if the patient is indeed someone that you can help. A consultation is important because the demeanor during the consultation will dictate the type of patient and the type of doctor and the type of the relationship between the both will be set up for the next several months. But again, if you think of this patient as number one, a very unique and amazing opportunity and a privilege for you to be with them. And if you treat this patient with all the utmost honor and privilege that they deserve, on the other hand, if you think of that patient as a potential marketer, as a potential marketing tool, as a potential referral, essential type of system, you think about that, that is amazing. If we're saying that each of the new patients should refer through patient, imagine the exponential development of this process. If I get one new patient today, and today's Monday, so I get a new patient Monday, and this patient in the next 30, 60, at the most 90 days is going to refer 3 patients. And each of them, within the next 30, 60, 90 days, will also refer 3 patients. So from this one new patient, I should be able to get 3 who are going to each bring me 3. Imagine how the numbers exponentially will grow and proliferate with one another. See, now suddenly, you're now thinking, this new patient is not just a walk-by. It's not just a one-time event. It's not just somebody that comes into your office and says, can you help me? How long will it take? How much does it cost? It is a tremendous source, and a privilege for that matter, of income to your office. See, that's what makes a difference. So now, if I treat this patient with the honor that they deserve, if I treat this patient with the utmost care, if I focus myself, if I'm able to give them what they need and give them what they deserve, they will turn back and give me everything that they have access to. After all, if you think about it, for them to refer 3 patients to me, not very much. What is that? That's just 3 of their friends. It could be a family member, it could be a colleague at work, and it could be a neighbor. That's all they have to do. And that's 3 patients. So if you get an average of, say, 15, 20 new patients per month, and they each refer 3 people, those numbers are staggering. They are monumental. Obviously, you don't need any more marketing. You obviously will not need any more at all, in any way, shape, or form, demands on any type of internal or external type of development. It's all focused on your clinic. But to do that, you have to be a kind, focused, extremely interested doctor. What do I mean by interested? Interested means I care about you. I need everything to be right here in the room. It's between you and I. There's nothing else in this room right now. It's just you and me. And I want to make sure that I'm focused in your treatment. I want to make sure that I give you everything that you need. I want to make sure that every part of your body, a holistic approach about your development, about your healthcare, is now in my hands. How would you do that? It's all based on a consultation, believe it or not. If during the consultation you're able to convince the patient that indeed you are going to be focused, and that focus is going to be energized strictly on the demands and on the needs of that patient, and the patient believes that, they will sign up for the program, but more than that, they'll bring others to it. So the consultation is the basis, it's the foundation for this building that we're trying to build up. And imagine, if you think about it, let's take a house, a big building house. There's the roof from the top. Obviously there's the attic, windows, second floor, first floor, kitchen, bedrooms, you name it. It's a whole house. All of the trimmings, all of the beautiful furniture, everything about that house would crumble in a matter of minutes if the foundation is not set up properly. So the foundation, as you can see, is a monumental concept which holds, and not only holds, but maintains the security of the home. So the foundation is. The foundation that you're basing your relationship with this patient is this consultation. From the very first moment that you meet this patient, and that you discuss with the patient the opportunity, the privilege, the honor, the time, and obviously the opportunity for you to exchange. In exchange for treatment, I get paid for my services. This relationship, doctor-patient relationship, is all based on this one-time consultation. Now you may say, well, not necessarily. I mean, a consultation could be quick, could be swift. It's all about, meeting the patient and giving them a general idea. It's all about selling them a product. That's probably the biggest mistake you could ever make. It is absolutely wrong. Erroneous. Mistake. No question about it. Why? It's the first impression. This is the very first time they meet you. This is the very first time they have access to your knowledge. It's the first time they look at you. And they size you. Patients will actually look at you and personify the type of person that you are. They'll look at you. They'll look at the watch that you're wearing. They'll see whether or not you're wearing a tie and a shirt. They'll look at you and find out if you speak with them, you are focused. They'll find out whether or not you are genuinely interested in their care. They'll find out whether or not what you say is what you mean and what you mean is what you say. They'll look at you that way. If you've convinced them on that day, done. The foundation has been based. The foundation has been laid, and you are now on your road to securing 3 patients from them. But more than that, you are on the road to success, to treating them. For a patient to get better, they have to believe that the doctor is someone that can help them. They also have to believe that they themselves are willing to put in their efforts and time and energy. And of course, money. If they come up with this attitude and you're able to develop in them this positive attitude, then indeed they will get better. And by getting better, of course, part of their results is to tell other people how wonderful your treatment was. The success of a doctor depends not so much on the type of clothes that you have, not so much on the front desk office, not so much on the type of music that you're playing, not so much on the kind of degree that you received and the expertise that you have. It depends on this relationship that you develop with the patient. The relationship is so important, interestingly enough. So much so that by just often meeting with a patient, you'll be able to develop a relationship with them, which is so personal, it actually makes them feel better. You haven't even done any treatment. You have not given them any modalities, any manipulation, any type of exam, not even anything. No medication, no prescription of any sort of medication whatsoever. The very fact, however, that you've spoken with them in a soft, focused, and extremely interested and unique way of the way the doctor develops a relationship with the patient, by doing that, they already feel better. Because you've gained their confidence, because you've convinced them that you are the person that they can come to. That's what we're looking for. So the consultation is extremely important. I need you to focus on these consultations. I need you to learn during the consultation to give your best, to give an adulterated type of genuine concern. Imagine if this patient was your own mother. Imagine if this person was your own son or daughter. Imagine if this was your own father. Imagine if this was possibly an older parent of yours that you haven't seen in a long time and who comes to you and begs you to help them. How would you feel? How would you want to treat them? I'm expecting you to react in a very positive way about this video. And I know many of you are very concerned and many of you give your heart out to your patient. They're our best connection to our profession. You've had the privilege to earn a degree. You've had the honor to open up an office. Now do yourself a favor and take this privilege and the honor and share it with others. Share the gift of health that you have in your hand with others. Share this gift that you have to heal people, but do it in such a way that convinces them that you are truly caring about them. And the only way this can be done is if you're honest. The only way this can be done is if you truly mean it. I hope this will be a day that you're going to use this consultation video, this streaming video which I'm doing right now, and that you'll be able to be literally taking your best and giving it over to your patients. I hope you have a great day, and I hope you make it happen. Thank you.